Good morning, everyone. It's my pleasure to give a lecture online. Today, I will talk about the application of contrast-enhanced ultrasound in the differential diagnosis of uterine tumor. First, I will give a brief introduction about the reason why we need CEUS in uterine disease, and then show some examples to illustrate its use. At last, we'll give a short summary. Why we need CEUS? As the previous lecture said, we need to assess the agent perfusion of the masses in order to give a more accurate diagnosis, as we expected that CEUS can achieve a similar effect to CT enhanced image. The mass, with or without agent perfusion, is a great important question, and the color Doppler can't always answer the questions. Then, how to perform the CEUS? The preparation are the same as in other organs. Participants were examined with conventional ultrasound followed by CEUS. Sonoview is injected intravenously into the body. The doses of transabdominal CEUS is different from that of transvaginal examination. The dose of transvaginal ultrasound is higher than that of transabdominal CEUS. Then, what should we focus on? Instead of the time intensity curve, the qualitative indicators can also provide a lot of information and are more convenient. We should focus on the features like arrival time, signal intensity, phase of enhancement and washout, and the distribution of agent in the mass. For uterine tumors, the reference is the myometrium. Degree of enhancement in the arterial and venous phase was recorded as hyper, iso, hypo, or non-enhancement compared to the surrounding myometrial tissues. The contrast contribution was recorded as homogeneity or heterogeneity. The arrival time was recorded as prior or simultaneous or after or non-wash-in wash-out compared to the surrounding myometrium. So, we should learn about the CEUS image of normal uterus firstly. Informed written consent was given by all participants. Then I will show two cases. The first one is a 29-year-old woman. The SD of normal menstrual cycle, that's to say, is proliferative phase of endometrium. From the image, we found that the sonoview reaches the myometrium first and then gradually spread into the endometrium. At the same time, we found the signal intensity of the myometrium is higher than that of the endometrium. The agent is evenly distributed in both of them. This case and the next case is a 27-year-old woman, the 20th day of normal menstrual cycle, with secretory phase of endometrium. The image shows the same enhancement mode with the last one. That's to say, the perfusion of agent is quite the same in the different phase of endometrium. Please keep in mind of the enhancement features is very useful for the differential diagnosis. Then, when we need CEUS, we will encounter complex clinical cases that need to be diagnosed. Let me show you some examples. Then the first question is, when the patient has the symptom of vaginal bleeding, ultrasonography showed thickened endometrium, how to make the differential diagnosis of benign and malignant mass. Just like the three females, they had the similar symptom, and their B mode image shows the thickened endometrium. Though the case B and case C seemed to have more color Doppler signal, it's still lack of confidence to give a diagnosis. Now, let's see the CEUS. We can clearly find that for case A, the enhancement mode is similar to the normal uterus. The perfusion sequence of contrast medium is similar to that of the normal uterus. In case B, show a synchronized enhancement with that of myometrium, and in case C, the arrival time of lesion area is also synchronized with the myometrium. Is vastly earlier than that the rest of the endometrium. The signal intensity was also the ISO enhancement. Therefore, we were more confident to indicate that case B and case C was malignant, and the pathological result confirmed our diagnosis. Thus, when the above features appear, we should consider the possibility of the endometrial carcinoma. That's to say, the agent arrival time is faster than or simultaneously with myometrium. The intensity is hyper enhancement or synchronized enhancement or ISO enhancement. The distribution is heterogeneous. Then I will show you a typical endometrial carcinoma. This is a typical example. Let's review again. The image showed a marked thickened endometrium. Yeah, here is a conventional ultrasound show the thickened endometrium, yes, with abundant flow. And let's see the CEUS, the arrival, I will show you the arrival time. The arrival time was almost synchronized with the myometrium. The signal intensity was also the ISO enhancement. So please remember, keep in mind the typical characteristics of enhancement. And then let's see another case. Except for the endometrial carcinoma, cervical cancer is another common malignant tumor of the uterus. In clinical practice, there will always be non-occupying lesion was found in patients with vaginal bleeding untouched or after sexual intercourse. And let's see these three cases. The lesions are difficult for a doctor to make a diagnosis according to the B mode. Here is a Grisiquil B mode, and here is a color Doppler image. We can't make a diagnosis only according to these pictures, they have the same symptoms or similar symptoms with vaginal bleeding untouched, and the last one is HPV is positive. And then let's see the contrast in enhancement mode. In case D, there was no obvious abnormality in cervical morphology. It shows a uniform enhancement except for the small cervical polyps with hyperenhancement. I will show you again. Yes, here. The perfusion of myometrium here, we can see a hyperenhancement, the polyps with hyperenhancement. And in case E, we can find the agent perfusion of the CEUS. The agent arrival time of cervix is earlier than that of the myometrium, but the whole cervix shows the same enhanced mode without any occupying lesion. What's more, the peak intensity of cervix, the peak of, I will show you again, and the peak signal intensity of cervix was the same as the myometrium. How about case C? The agent arrival time, The agent arrival time of tumor area is still earlier than that of the myometrium. It's earlier than that of the myometrium and the rest cervical area compared with case B, case E. We found that the difference is that there is a hyper-enhanced tumor in cervix. Pathological confirmed again the CEUS image. This case is the 34-year-old woman with an endless menorrhea for 3 months, a typical cervical cancer. Here is the mass. Please remember the CEUS imaging of it. I will show you. A subjective hyper-enhancement in degree of in arterial phase was observed, and a prior wash-in pattern was also showed in this case. Yes. Here is very typical. Yes, CEUS. However, the published study suggested that CEUS can help to find out the lesion larger than 1B, but show no benefit in diagnosis of stage 1A. Then the summary. CEUS can provide more information to diagnose uterine mass in complex clinical practice, and the guideline had partially admitted its value in diagnosis some gynecological mass, but more study is still needed. That's all. Thanks for your attention.